One of the primary reasons we do psychological assessment is so that we can accurately diagnose individuals who are suffering from psychological disorders. Because if we can accurately diagnose them, then we can better able treat them, or would be better able to treat them. It's easier for us to identify appropriate treatment strategies when we know or when we have a pretty good idea of what the person is dealing with. So, when we diagnose psychological disorders, we make use of diagnostic classification. So, different disorders are assigned to different categories based on certain traits and characteristics or attributes that they share. And then for each of those different categories, there's a listing of individual disorders. And for individual disorders, many times in different classification systems, you will see what we call diagnostic criteria, a set of criteria that, in order to be diagnosed with a particular disorder, individuals should experience or should show. Now, when it comes to diagnosing disorders, of course, there are a number of issues with classifying and diagnosing disorders. There are things that folks who work in this area have kind of debated about over the years in terms of how we should approach diagnosis and classification. Um, Over time, there have been different approaches to diagnosis and classification. Some of the main approaches have included both a classical approach, which is categorical in nature, and a more dimensional type of approach. So the categorical approach suggests or puts out there very strict categories of disorders, and they're people are viewed as either having that disorder or not having it. So there's a set of criteria, and if they meet a certain number of criteria, then that person might be diagnosed. They might fall into that category in a sense. But in recent years, we've kind of moved more towards what we call a dimensional approach. And the dimensional approach assumes that it's not an either or kind of thing where you either have it or you don't. It's that it varies depending on the person and the situation and that kind of thing. So, looking at different disorders in terms of dimensions and where individuals might fall on a spectrum. That's what that dimensional approach involves. And with DSM 5, there's been a movement towards a more dimensional type of approach. DSM-5 is the classification system that is currently used in this country. And so DSM-5 is the fifth edition of the Diagnostic and Statistical Manual of Mental Disorders. The Diagnostic and Statistical Manual is a manual that's published by the American Psychiatric Association, and it's updated about every 10 to 20 years. With those updates, sometimes new disorders are added, sometimes disorders are omitted or deleted. The diagnostic criteria for different disorders change over time as well. So, those are some of the things that we see with each of those updates. The current edition is DSM-5, and we're going to look at DSM-5 in just a couple of minutes. The most recent edition prior to DSM-5 was DSM-4 TR. The TR stood for text revision, and we'll look at some of the earlier editions as well. But that's what's used primarily in this country for diagnosis. In other countries, mental health professionals often rely on the ICD, the International Classification of Diseases, and we're currently using the 10th edition of the ICD, and that's something that's published by the World Health Organization. But again, here we typically make use of the Diagnostic and Statistical Manual. And so these are the covers of some of those diagnostic and statistical manuals. Here we have a pocket edition of DSM-3R. DSM-3R was the third edition revised, and so that's what came out immediately prior to DSM-4. With DSM-4, as I mentioned a minute ago, there was then a later revision called DSM-4-TR or DSM-4 text revision. And then this edition is that current edition, the Diagnostic and Statistical Manual, 5th edition. And so as we talk about different disorders this semester, we're going to be looking at the diagnostic criteria that are most current, so what we see in DSM-5. Now, prior to 1980, a lot of the diagnoses in the Diagnostic and Statistical Manual were based on either biological or psychoanalytic theory. The DSM was really originally based on more of a medical model or a medical approach. And we've kind of moved away from that a little bit over time. But in those earlier editions of DSM, that was really the focus, more of a medical approach or a psychoanalytic approach. But then with DSM-3, which was introduced in 1980, that changed a little bit. With DSM-3, classification started relying on specific lists of symptoms, and that was in an effort to improve both reliability and validity of diagnoses. And with DSM-3, we saw the introduction of what we called a multi-axial system. Individuals were diagnosed on the basis of, or their behavior was classified on the basis of 5 axes describing different types of problems. For example, things like disorder categories, health problems, life stressors, and so on. So in those editions that had that multi-axial system, the different axes included axis 1, axis 2, axis 3, axis 4, and axis 5. Axis 1 is where the different clinical syndromes, or most of the different clinical syndromes or disorders, were classified. So things like depression, different types of anxiety disorders, schizophrenia, and other psychotic disorders. In those earlier editions, all of those were included on Axis 1. And then Axis 2 included more long-lasting types of disorders. So what we call personality disorders, things like antisocial personality disorder and borderline personality disorder, narcissistic personality disorder, and so on. Those were all diagnosed on Axis 2. But Axis 2 also included what at that time was referred to as mental retardation. We've changed some of that terminology so that now it's not referred to as mental retardation. Instead, it's intellectual disability or intellectual disorder. But those, the personality disorders and mental retardation, were both viewed as sort of long-term disorders, very long-lasting disorders. Axis 3 was for classifying any relevant medical conditions. So if the individual had a medical condition that was in some way related to or maybe exacerbated that clinical syndrome or that long-term issue, that would be coded on Axis 3. And then Axis 4 was a way to assess relevant life stressors. So things that might be going on in that person's life that could be considered stressors that, again, could be exacerbating or contributing to the clinical syndromes that individual might be experiencing. And then Axis 5 was what was called a global assessment of functioning. And it was a rating scale. It was a 100-point scale, so individuals could be assigned a score somewhere between 0 and 100, and it was meant to assess overall functioning, how that individual was functioning overall. Now, DSM-3, DSM-3R, DSM-4, and DSM-4-TR all included that multi-axial system. But DSM-5 was a pretty significant overhaul of the Diagnostic and Statistical Manual. And one of the big things that happened with DSM-5 is the manual lost or got rid of that multi-axial system. So the multi-axial system was removed and some other things were added or some other things were changed in order to, or in an effort to make diagnosis more reliable and more valid. So in addition to removing that axial system, the criteria for diagnosis of different disorders, attempts were made to make that a little bit more clear so that we could be more specific about what might be included as an example of that disorder or what might be excluded. The disorders were categorized under pretty broad subject headings, and so that's what this shows, an example of some of those broad subject headings. They include things like neurodevelopmental disorders, schizophrenia spectrum and other psychotic disorders, bipolar and related disorders, depressive disorders, and so on. There are a number of different broad categories of disorders, and within each of those categories, there is a set of specific disorders and the diagnostic criteria for each of those specific disorders. And those diagnostic criteria are meant to be pretty specific or as specific as possible. Here on the screen, you see the diagnostic criteria for what's known as generalized anxiety disorder. And if you look at the diagnostic criteria, you'll see that for generalized anxiety disorder, there are 6 basic diagnostic criteria. First of all, excessive anxiety and worry that occurs more days than not for a period of at least 6 months. A second one, the individual finds it difficult to control their worry. Third, the anxiety and worry are associated with with 3 or more of the following symptoms that have been present for about the last 6 months. So we would want to be sure that the person exhibits at least 3 of those and that they have been for that period of time. And then the fourth diagnostic criteria, that anxiety, worry, or physical symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. For any of the diagnostic criteria, there's going to be one in there that specifies this, that it should in some way cause significant distress or impairment in that person's functioning. And then the fifth criteria, disturbance is not attributable to the physiological effects of a substance or other medical condition. And finally, sixth criteria, the disturbance is not better explained by another mental disorder. So the person and what they're experiencing in terms of symptoms doesn't fit better with another type or another classification or another disorder.